Treatment and prevention of pneumonia. Pneumonia is a form of acute respiratory infection that affects the lungs. When an individual has pneumonia, the alveoli are filled with pus and fluid, which makes breathing painful and limits oxygen intake. Streptococcus pneumoniae is the most common bacterial cause of pneumonia, but other bacteria, virus, and fungi can cause it too. Treatment for pneumonia depends on the type of pneumonia you have, how sick you are feeling, your age, and whether you have other health conditions. It's important to follow your treatment plan carefully until you are fully recovered. Most of the time, pneumonia is treated at home, but severe cases may be treated in the hospital. It can take anywhere from 1 to 6 months for a person to recover and regain strength after being hospitalized for pneumonia. If your pneumonia is caused by bacteria, you will be given an antibiotics. Cough suppressant may be used to calm your cough so that you can rest. Coughing helps loosen and move fluid from your lungs. Other treatment may include healthy diet, increasing fluid intake, getting rest, oxygen therapy, and medicine for pain and fever control. Most viral pneumonias don't have specific treatment. They usually get better on their own within 1 to 3 weeks. Some cases are more serious and require a hospital stay. Antiviral drugs might be prescribed to decrease the length and severity of the illness. Prevention. There are several ways to prevent pneumonia. They are: practice good hygiene. Wash your hands frequently to protect yourself against respiratory infections that sometimes lead to pneumonia. Wash your hands before eating, before handling food, after using the restroom. When you are in public places, if soap is not available, use an alcohol based hand sanitizer. Stay away from people who are coughing or sneezing. Do not touch or share objects that are shared with others. Try not to touch your eyes, ears, nose, and mouth. Germs can be transferred from object to you if you touch your nose or mouth without washing or sanitizing your hands first. While you are recovering, try to limit your contact with family and friends to help keep your germs from spreading to other people. Cover your mouth and nose when you cough. Promptly dispose of tissues in a closed waste container and wash your hands. Get vaccinated. Get a flu shot once every year to prevent seasonal influenza. The flu is a common cause of pneumonia, so preventing the flu is a good way to prevent pneumonia. There are two types of pneumococcal vaccines which will protect you from a common form of bacterial pneumonia. Children younger than age 5 and adults age 65 and older should get this shot. Receiving all recommended vaccinations is one of the best ways to prevent pneumonia. Be aware of your general health and keep your immune system strong. Getting treated for any other infections or health conditions you may have is very crucial. These conditions could weaken your immune system, which could increase your chance of infections. Practice good health habits. Eat a healthy diet, get enough rest, exercise regularly, which will help you from getting sick from viruses and respiratory illnesses. They also help promote fast recovery when you do get a cold, the flu, or the respiratory illness. Stay away from smoke and alcohol to let your lungs heal. This includes smoking, secondhand smoke, and polluted air. Tobacco damages the lungs' ability to fight off infection. Exposure to smoke may increase risk for future lung problems. Avoid excessive consumption of alcohol. Complications of pneumonia. Most people with pneumonia respond well to treatment. However, even with treatment, some people with pneumonia, especially those in high risk groups, may experience complications. Complications may include acute respiratory distress syndrome. This is a severe form of respiratory failure. Renal failure, a condition in which the kidneys stop working and are not able to remove waste and extra water from the blood or keep body chemicals in balance. Empyema, pus in the pleural space, pericarditis, inflammation of the sac surrounding the heart, sepsis. Sepsis is a medical emergency and life threatening condition that arises when the body's response to infection causes injury to its own tissues and organs. In about 30% of people with pneumococcal pneumonia, the bacteria invade the bloodstream from the lungs. This can cause other lung problems and certain heart problems. It may lead to widespread organ failure. Pleural effusion. Pneumonia may cause fluid to build up between layers of tissue that line the lungs and chest cavity. If the fluid becomes infected, you may need to have it drained through a chest tube or removed with surgery. Lung abscess. A lung abscess is a cavity filled with pus. These are pockets of pus that form inside or around the lung. An abscess is usually treated with antibiotics. Sometimes surgery or drainage with a long needle or tube placed into the abscess is needed to remove the pus. Outlook. Pneumonia is a serious condition and can be life threatening if left untreated, and especially for those individuals at increased risk for pneumonia. Pneumonia caused by bacteria or viruses can be contagious when the disease carrying organisms are breathed into the lungs. However, not everyone who is exposed to the germs that cause pneumonia will develop it. It may take time to recover from pneumonia. Some people feel better and are able to return to their normal routines within a week. For other people, it can take a month or more. Adequate rest is important to maintain progress toward full recovery and to avoid relapse. If you like this video, please give it a like, share it with your friends, and don't forget to click on the bell icon to get new video updates. Thanks a lot for watching this video. Bye bye.